Advocate for yourself. What do that mean? Be your own advocate. Ask questions, write down, make notes, reach out to third parties, do whatever you need to do to make it right for you. First thing, know your rights. Know exactly what comes along with your health care, your health insurance, your medical insurance plan. Know your rights. If it says that you are covered for an x-ray, make sure you get your x-ray. If they say that you have to pay for the x-ray, but your insurance, your health insurance, your medical insurance says you don't pay anything, know your rights. Don't you dare pay for anything. If you need to pick up a phone, flip the medical health coverage card over, because whatever coverage you go with, you're going to get a card. And on that card, it will have your ID number, it'll have your name, and it'll have different phone numbers that you could call. Call the number. Make sure you know what you're talking about. Make sure you know your rights when it comes to different things, whether you go into the dentist, go into a doctor, go into a gym. We will talk about that a little bit, but even the gym is covered under your health care. So know your rights. Trust what you know. Oftentimes we will know that we're right about something, but because somebody with a degree or somebody who's standing on the opposite side tell you you're wrong, we take that answer. No. Trust what you know. Identify what you know. Read up on what you know. Back up your information with documents and proof if need to be. Again, according to what state you live in, you can always find the information you are in need of on Google, at your local health library. Yes, there is a health library. For those of you who do not know, inside of a health library, you'll be able to find billing codes and names and words that the doctors and the healthcare providers use is in that library. Get familiar with your insurance. Know what your insurance offers you. Understand what your health insurance is offering you. Understand the carrier. Understand how much money that they will offer you. And I know you like, they offer you money? Yes, they do. Those are us who's buying Tylenols, who's buying Ace bandages. There's majority of health care providers, insurance providers, they will offer you up to $30 per month to buy things such as Tylenol, anything that have to do with over-the-counter things that you could kind of go to the store and get. Your health care insurance will take care of that. But again, if you're not asking for it, it's not going to be given to you. You have to make sure you know your insurance plan. Get familiar with your health care insurance. And I say get familiar with your healthcare provider, because although the healthcare provider is not your healthcare insurance, but your healthcare insurance pays your healthcare provider. So you get familiar with both of them so you can understand what you are in need of. Ask questions. Ask questions. It's okay. They're going to get paid regardless. If you have a concern, you need to put your concern on the table. Ask the questions that goes with your concerns. Do not let no one shut you down when it's about your body, when it's about your mind, when it's about your health. Be your own advocate. It's nothing better than knowing yourself, because at the end of the day, the healthcare provider job is to make you feel better, to make your mind feel relieved, to make you do anything that you need done. When you walk into a healthcare provider, your health insurance is going to allow you to get everything that needs to be done. If someone is telling you that you need an x-ray for your neck, but you know you feel pain in your hand and in your shoulder, insist on them doing that x-ray on your hand and your shoulder first, and then go with their opinion. But overall, don't be afraid to take notes.